I want to now move on to our next speaker, who is Phil Shelley. Phil comes to us from NHS England and NHS Improvement, where amongst his other roles, he was chair of a review panel of a really sad incident where patients had become, well, poisoned sort of from food that they acquired in hospital. And so obviously patients who are vulnerable, you know, if we're not attentive to the high quality of food, and I suppose food risks, it could be an especially, you know, difficult scenario, and, you know, had tragic outcomes. Phil was in charge of that food review, and I think that's led to some very positive changes. Today, he will be talking about how empowering recovery through food is an essential part of treatment within healthcare. So thanks very much for joining us, Phil.
You're welcome, David. And my goodness me, what a fantastic set of sessions that we've actually had today. And it's such an exciting project to be part of the discussions around, you know, Cambridge Children's Hospital. And I feel privileged to be part of the discussions that are taking place. I mean, picking up particularly this morning, the session from the Wendy Wills, who, you know, highlighted that one size does not fit all, and often families face competing challenges and conditions. So we have a balancing act, and certainly when we were asked to do the food review, then it was important to have a much wider viewing of the challenges that are out there. So thank you, first of all, for asking me to share some thoughts and plans from the NHS Food Review. As David says, you know, we're a little bit of time in now. We're nearly year one into our review and recommendations. We've labelled the programme Great Food, Good Health. And this helps us to sort of shape the future of NHS food. And for me, it was a great opportunity to be part of the discussions around children's food, which is certainly started to take a really important focus. Start to kind of understand, you know, how do we prioritize our longer term plan and our sustainable future for the NHS, and at the same time not forgetting why this review took place. You know, and as David shared, you know, the listeria outbreak affected 7 patients, passed away, and that was through infected sandwiches. We know that sandwiches is very much part of hospital life. It's a choice that people like, particularly if it's a soup and sandwich scenario, but it's a high risk food, and it's something that we need to lift our standards on food safety, but in other areas as well. When the Secretary of State asked for a root and branch review of hospital food to take place, it gave us that wider opportunity to look at other areas. So we widened the scope, not just food safety, but look at nutrition, look at the quality of food for patients, but also for staff and for our visitors. And it's important that we now have a distinct focus on children's menus, you know, for the first time for a long, long time, and the surrounding facilities that we have actually in our children's areas. So how do we also acknowledge the importance of parents being able to support their children through their recovery? So as you can see by the slide, well, policy. Well, first of all, we need to be consistent around the direction that we take. You know, we've got to have clarity. We need safety to be at the forefront of healthcare catering. And we need to have that quality of product. So our service level, well, who's responsible? Well, in a way, we're all responsible to some degree, but we need to look right from the beginning of how do we buy our food, how do we present it and serve it, and how do we test it to ensure that it's safe to use, and of course, ensuring that it's enjoyable. How do we lead? And what is the strategy for that service? And our focus on food, well, it's incredibly emotive topic. You know, for all of us, food and drink is at the top of our agenda, whether we're at work or we're at home or we're actually out and about. You know, we all have different tastes. We've got our favorite choices and our dislikes. So our future planning, well, I think that this is a great opportunity for Cambridge Children's Hospital to be the exemplar site for children's food. How can other people look in and see what we're doing? Some of the pain that we will go through to create what does good look like. But it's so important that we set a standard that, one, we can be proud of, but also we know that those children that come through our care actually enjoy being in that place because they know that we are creating an exemplary model. And the other part is ensuring that the exemplary model has that push on to the parents that also come through our system. The next slide, please. So part of the recommendations was to form an expert group, and this is up and running. We've got 14 individuals that form that group. They have a passion to inspire colleagues, you know, within their topic. So when we looked at the group, we wanted to ensure that we covered a wide range of topics, you know, and we called it the power of three. So we have our nursing, we've got our dietetic, and we've got our catering, and they together as 14, they're co-chairs of 7 subgroups. So we tried to cover all the areas that we knew would be very topical when it comes to try and turn over that new leaf for healthcare catering. Of course, as expected, everyone wants to have their say when it comes to directional change. I remember the 6 C's of nursing, and for us in estates facilities management, we talk about the 3 C's, and that's cleaning, catering, and car parking. And often those 3 areas have the biggest impact on people first coming into a hospital, you know, and it's so important to try and be positive because, you know, it's a nervous time for people, you know, they're not always sure what they're coming into. And so it is a key topic. Everyone wants to have their say. We need to ensure that we listen. So spend more time listening than we do actually talking to these groups, and ensuring that we absorb the variance of views. We've had a couple of subgroup meetings today, you know, and one of them is our critical friends, where they're out and about on hospital sites. They've got years of healthcare experience. And it's so important that we listen and we use that experience. What's working well right now in the NHS for healthcare catering? What areas are we struggling? What are we doing regionally? What are we doing nationally? And how can we actually, you know, move on to actually agree on what's right for the NHS? So good food, we know, aids recovery. It's a natural medicine. And if we're creating balanced choices that children desire, we need to be aware of the balance of food. So over the coming months, the new food and drink standards for healthcare will be launched. And this is aligned to the food review recommendations with the opportunity to mandate through the Health and Care Social Bill. What is apparent is that we need to maximize the opportunity of digital within our facilities team. So menu ordering as close to the point of service as possible. We're protecting from allergies and intolerances. We're creating a care plan to map out the nutrition and the hydration for each child. So important to understand that individual aspect when we're dealing in such big numbers in the NHS. Next slide, please. As I shared, it's our vision to drive exemplary in all areas, support those that need direction, use a whole hospital approach to prove that anything is possible. All of us that are involved in the service of food understand the key role that we play in our society. If you look back over the last 18 months, I think we've woken the public's awareness up of what we do, what we actually need to do the job well, and what standards should we be proud of? And as a whole hospital approach, we need food and drink to be at the top of the agenda when board level meets. You know, what food is being served to our patients, to our older people, to our younger people, what food is being served to our staff and our visitors. Around the NHS, there are many managers and many caterers that are natural innovators, but we also need to let them develop. They're already driving change in their hospitals and their trusts. They're already showing fantastic leadership qualities. This needs to be shared and promoted. We often talk about data being used to drive our decision-making. The same-day ordering for patients, where possible, should be the aim. How can you possibly be ordering what food you want for tomorrow when you don't know how you're going to be feeling? What sort of mental state are you in? What sort of physical state are you in? We also need to understand what our staff require in retail and our 24/7 in reality. We know we've got big issues around food waste, and we need to strengthen our power partnership approach. So where possible, ensure that we've got dynamic collaboration. Leading change in any sector is really, really stimulating. The public sector is often described as immovable. For me, this is the ultimate challenge. Every child is an individual. They don't necessarily want to eat at 7:30, 12 noon, 5 p.m. How do we create a flexible approach with choice of menus in a relaxed environment? We know that major transformation can often cost money. For me, the biggest shift is around behavior and around culture. Yet the NHS endeavours to provide a solid platform for assurance. What we must also do is use that platform as a springboard for change, change that will make a difference to all of us. Next slide, please. In the latter part of last year, I was contacted by a mum in the south of England. Her daughter was 10 years old, and after being diagnosed with cancer at 9 years old, time was running out. I met with the mum and the daughter, and we spoke for an hour, and we shared a bucket list of who she wanted to meet and what she wanted to do in the little time that she had left. Her experiences in hospitals drove her to put improved hospital food on the bucket list. Now, I felt ashamed. I felt that we'd let her down, and no doubt many others before her. She passed away in September last year, and I believe that her wish for change will happen. And this new hospital will be the proof of that change. What can we do between now and that point in time to ensure that children's food moves in the right direction? I'm working with Ruth May, the chief nurse now, to get under the surface of some of the issues that we face. Our menu planning, the access and the availability, enabling all parents to be with their children at meal times as it should be. Some of those facilities are so run down. They've often been closed in COVID. It's time to get those areas open now, if possible, so parents can come back in and spend that treasured time with those that are under our care. Next slide, please. Our patients do not choose to be in hospital, which makes our care within the surroundings even more important. You probably know that Prue Leith has been the advisor to the review, and her understanding of the importance of good food has been essential in driving decisions of quality. Yesterday, her and I met with Sajid Javid, the Secretary of State for Health and Social Care, and it's vital that we have his and the government's continued support for the changes that need to be made. And yesterday she described the challenge. You know, what other establishment do we have where the customer doesn't want to be there? They can often not be with the people that they want to be with. They cannot find anything on the menu that they like, and they are told what time they have to eat. And at least 25% of them have dietary or special requirements. It's not supposed to be easy, and it isn't. And we need the specialists to advise and prepare children for meal times. The relationships between those teams within the clinical setting is paramount to ensure that the food and drink that is served is being served in the right way, the children are prepared, and they are receiving the right food that aids their recovery. Next slide, please. Part of the review is to promote the role of the caterer, particularly chefs. Leaving culinary colleges, they often go directly into restaurants and hotels, not the public sector, as in hospitals, schools, and care homes. And in July, we launched Nhs Chef 2021. Regional competitions took place throughout August and September, and this has been a fantastic opportunity to showcase our Nhs chefs, their expertise, their commitment to the role, which has been particularly significant throughout the pandemic. There was a massive focus on the style of our menus. They need to be healthy and balanced. Look at our plant-based choices. How much are we using our British products? How are we bringing our seasonal variety into the menus? And big areas like breakfast were looked at. But children's menu probably caused most discussion. And often we look back at our menus 20, 30 years ago, and often those are the same style menus we've currently got in our hospitals. This is an enormous opportunity to change the face of NHS food choices. We need to work with our health partners and our organisations. We need to think about the style of crockery, the dining facilities, have conversations with our chefs so they can identify with those children, well, what do you enjoy eating at home? What can I replicate to help your stay be more satisfactory? I think it's time to look in the mirror and start to work with our allies, within our hospital setting. So work closely with those nursing teams, occupational therapists, our physiotherapists, and our dietitians. And as well as that, listen to the advice from our external experts in their field before we make the decisions going forward. I've always believed that this review is driven from within the NHS, not from the outside, but from within. So we need strong, compassionate leadership with an ability to understand what facilities and equipment do we need to create flexibility and adaptability. Is the food service model appropriate, or does it need changing? Are we people-centered throughout the whole process of food ordering, preparation, and service? It's difficult to quantify success. I've always believed that what we can achieve is almost immeasurable. If we have the appropriate skill mix, the suitable investment of time and finance, then we must have the courage for change. if we have that, then our possibilities are unlimited. I hope that gives you an overview of what the food review brought to the NHS. It's really important to recognise that children's food is taking a much stronger role as we move forward in time. And I hope that as part of the review, I will work personally with this team and involve one of our subgroups to ensure that what we learn over the coming months can be integrated into what Cambridge are doing. So Cambridge Hospital becomes the exemplar that we can be proud of and we can be measured against to ensure that the children in our care get a service that is much more appropriate for today. Flexible food, healthy food, balanced food, food that will build those children up so they can go home in a stronger condition, so we're empowering their recovery. Thank you for your time today.
Well, thank you so much, Phil, for that, not only for that fantastic talk, but also the passion that you're bringing to this terribly important topic. And, you know, the vision is exciting, important. The food legacy of the patient who sadly died of cancer, that's a legacy that we'd like to live up to. And we would be thrilled in Cambridge Children's to be a test bed for some of these principles. I'm also reflecting on the video earlier today, where we had a lot of children that are, you know, they're setting an agenda for us, but a lot of those points reflected in your talk. And so I want to turn to questions, and maybe in a second, could I ask Beverly May to come on to ask her question, but to phrase it and maybe put it in perspective. There are a number of questions that come, there's our relationship to community. So that could mean carers who want to bring in special foods, or that could mean potentially locally sourced foods that might be a slightly, you know, different pathway for procurement. But I'm going to sort of let that question hang, and then maybe Beverly, if you could come and ask your specific question. Beverly's a housekeeper in pediatrics. So Beverly, over to you. If you can unmute yourself. It's if not, I could read it for you, Beverly.
Hello. Okay. Hello, can you hear me?
Yes.
Hi, yeah. Sorry about that. Yes, sorry, my picture's not very clear. Right. I don't know why. Yeah, it's interesting because thank you, it's fascinating information, and I've made so many notes on potential areas that I could make small tiny changes to make headway on this. But it's really interesting with where we're at the moment. Like we have, I'm at the Darwin Centre for Children and Young People, 11 to 18, and we have breakfast, lunch, and dinner, and because of the ward that it is, young persons at certain times can access the kitchen to make a sandwich or a small snack, but there has to be the staff to help them with that. But it's interesting about, it would be lovely to have sort of food sort of on demand all the time, to their choice. But it's really interesting because dealing with teenagers, I know I've got one myself, you know, sometimes they're not up till midday, they haven't had breakfast, their breakfast is at tea time, their tea they want at 2 o'clock in the morning, and my concern is like the food safety side of things. I'm forever thinking, oh, that sat there for an hour, or a parent's brought some food in, but for whatever reason, patient doesn't actually see the parent, but food's just dropped off. And I sort of think, oh, I don't know what's in it. I don't know how long it's been traveling or how long it's been left out. Sometimes it's left out because I only work Monday to Friday, 9 to 5. And sometimes I'll come in and I'll see a pot of food and I'm like, oh my goodness, I can't have this is horrendous. You know, because I'm thinking of with my health and safety hat on. So I hear everything and I'm thinking this is wonderful. I'm just thinking of the practicalities of how we go about having food available for people when they want it, with the safety in mind.
Yeah, I totally get it. I totally get it, Beverly. And we are very risk averse, aren't we, in the NHS? We're often, choice can often be cut because we're frightened to take that step, and we all need the confidence that can happen. And I think, you know, I don't know any other children's hospital at the moment that has got a totally open door and an open clock to meal service. I think we have a massive opportunity in front of us. So you know, we'll be doing some work in the background to support what could happen with you. But you know, it's funny. Your role as the housekeeper, you are very much an axis of the catering and the ward level, and you're the glue to keep things together around food safety and around service and understanding what that child requires. So you're the type of person that we need to have the conversations with to understand the challenges that you get.
Yeah, absolutely. Because I work with the children a lot. I go to a lot of their meetings. You know, they're asking me for different types of food and what they like. I've devised, like, I do seasonal menus. So I change them up every quarter, and we do tasting sessions, and it's really interesting, and I'm just fascinated to see where it goes. It's just, I wish I could clone me so that there was someone there the rest of the time when I'm not, because you just want what you've done so far to happen the rest of the time. Yeah.
That's great, Beverly. Well, thank you so much. I think it's, you know, vital perspective. And Phil, you'll see some other questions in the chat that have to do with this sort of relationship with community. We do live in a very fortunate community that's very really rallied during the pandemic to create food hubs. The idea that community could be supplying you know, ingredients, helping to subsidize. I think that would actually be a great connection to think about. And Wendy, I was going to hand off to you because I know you've been monitoring for questions. So maybe you could pose one or two questions to Phil before we end.
Yeah, thank you. No, it's all fascinating, isn't it? I just wonder if Isabel, whether you wanted to ask your question yourself, because Isabel was asking about locally sourced food, local production, you know, local along that whole spectrum of how we produce food as a way of minimizing waste, which is another important element that you did touch on. I don't know if you want to expand on that, Isabel.
Thanks, Wendy. Thanks for a fantastic talk, Phil. I was just, I'm a psychiatrist, so it's not my area at all, but I was just interested in the whole issue, which is so relevant to all of us, of sustainability, and living in such an area of the country where there's lots of food production, etc. I'm just wondering whether Cambridge Children's Hospital can do something around sustainability, including working with local suppliers, food production, processing, distribution, and thinking about waste minimization, whether that's something that you're considering as a department regionally across the country.
I'll answer as best as I can. I'm in the middle of a building site at the moment, so if it gets really loud, the drilling, then I'll answer in the chat. But I, you know, there are so many parts of the country. I was speaking to Dorset earlier, and you know,